Welcome to Coach Soul, the podcast where we explore therapeutic ways to the best versions of ourselves. I'm your host, Steve Hudgins. I'm a licensed professional counselor dedicated to helping you navigate life's challenges. In each uplifting episode, we'll discuss mental health, relationships, self-care, emotional well-being, and personal growth. Join me and with my co-host, Kenya Evelyn, a therapeutic life coach, where sometimes we'll even welcome special guests to our show that share their experience and expertise. So let's embark on this transformative path together and discover a healthier and happier you. All right, welcome back to Coach Soul Part 2 with Therese Tonning from Norway. She is a therapist that practices EQ therapy, which is emotional intelligence therapy. Teresa, welcome back to Coach Soul again. And, I have so many different questions after this last podcast that we did last week. And one of the things I want to talk about is here in the United States, we talk about evidence-based. Is it where it is proven effective that you've had success rates? It started in Norway. Kind of talk again about the roots of emotional EQ therapy. How was it discovered?
Yeah. Thank you, Steve. Thank you for being here again. It was in 2006, as I mentioned before, Herdis and Dora founded the EQ therapy. And they both went to a family therapist education in Denmark. It was, what's his name again? Niels Juel. Have you heard about him? It's it's a well-known therapist in Europe, at least. And they discovered things with that therapy that they wanted to change because they really wanted to get even deeper. So these two wonderful women made EQ therapy. And they have a long range of education in teaching and, child development and everything like that. So that was the foundation. And in 2010, they started this school to educate therapists. And I was in the first group. And then it just growed and growed and growed. And now we have three schools in Norway. And it's in 3 big cities, Oslo, Bergen, and Stavanger. And maybe it will come in more cities as well. It depends on, all the therapists that is educated each year. They do a lot of things, courses, groups, schools, everything around. So, and I also heard that you were asking about education for people outside Norway. Did you do that? Yeah.
Yeah. So you talk about it's in the cities as institutes and things like that. What do you mean by institute? Is it just a specified training like we do here for EMDR? It's specialized training that we get. There's a certification that you get through. Talk a little bit more about that institute and is it in other countries or just specifically Norway?
So far, it's just specifically Norway, but we also have plans to make courses to reach therapists in other countries. That will be an online course. We are actually working on that now. Me and Herdis and Dora are working on that. So we are planning to have a course to certify. Do you say certify? Yeah, other therapists. And also, it would be great to have schools in different countries, but that will take time. It's quite young yet. So, but many plans. And So the school is like institute. It's a house with classes, right? So the
Okay.
students
Yes.
come, and also there are online courses, 1 year online courses for people that just want to get to know more about themselves and the EQ, what is EQ, and all these things. And it's courses based on weekends that people can come and work with themselves just few weekends without being a therapist. So it's different courses and different programs, but the EQ therapy is the school for that's 3 years. So we
Three
go there,
years.
yeah, 3 years, but it's part time. So you go 3 days each month in 3 years, and then you study in the weeks in between, right? Because it's an inside job. All the therapists get a lot of therapy to release their own trauma, and also practice on other students and people coming from outside into the school, and they get therapy, and yeah. So
So
that's the main.
so basically what I'm trying to understand is that if I wanted to go, let's say I'm already in Norway and I come to you and I say, Teresa, I want to learn.
Yeah.
And so in this institute, in class,
Yeah.
you're teaching me how to release my own emotion.
Yes.
And that own emotion will determine on how much I'm willing to release that and not try to block my feelings.
Yes.
Once I begin to know that I'm healed, then the training on how to do this starts.
Yeah, it's kind of both things all the 3 years. It starts with, the teachers. It's always 2 teachers in each class, and it's maximum 18 students in each class. And the first year, it's mainly receiving therapies from the teachers in groups, right? And it's different topics, different lectures, different books, different things. You go through that first year, and the next year you start to give other students therapy as well, and also receive from other students. So it's like a progress in. So you both receive and give at the same time.
Okay.
Yeah. It's therapy to give therapy. That's my opinion. Because,
well, I mean, I had therapy to become a therapist, so to speak,
yeah.
Because I wanted to make sure that therapy was what I wanted to do. And because of my experiences and what I've been through, it's trauma just affects people in just different ways. And, leaving the engineering field is no different than engineering the mind for me.
That's true.
Because I do dive in deep with my clients to get them to that healing. And when you're dealing with the trauma of this client and this feeling, do EQ therapists, are they confrontive with their clients, saying, talk a little bit about that interaction between that client? How deep do you go? Are you confrontive? Do you hold them accountable? Do you help them from stopping from dissonance and reflecting and deflecting, those type of things?
Yes. Everything, I would say. And the main thing for me, I think, is to kind of just connect with the clients, because I just tune in. I guess you know what I mean with that. Tune in to the clients, and then I can feel where they are willing to go, what's there, what are they ready to do, and it's like a dance in a way, if that makes sense for you.
Sure.
And sometimes I really need to confront. I don't like the word confront, but just make them see something, right? And it
Okay.
can feel confrontive maybe,
So
but
make
still,
aware.
yeah, make them aware and push or not push. It's like just feel the client. And the goal with all this is to be fully responsible and accountable for our own lives. So it's a very, very important part of the therapy process. And I believe that this is what's happened when we release the traumas, because then we are not an adult child anymore. We become an adult who takes responsibility and accountability for our own lives and ourselves, and also for
Sometimes we talk about personality disorders like narcissism, borderlines, histrionics, these type of personality disorders. Does EQ therapy have a success rate of reversing narcissism or borderlines or any kind of personality disorder?
Yeah, absolutely. I have had many clients coming in my office and saying they have this diagnosis or whatever. But when they start to release the traumas, they change. It's not a diagnosis anymore. I strongly believe that all these diagnoses is just names on the symptoms of suppressed traumas, really.
Oh, for sure.
Yeah, so it's like, yeah, it just disappears, it changes. And also narcissism, I mean, I will divide that in two, because one is being born with, because it's something wrong, in the frontal
Okay. Yes.
lobe. But the other thing is narcissistic traits. It's like you have these survival modes. So you
Yes.
act or react in different ways because you are really full of shame, and you do whatever it takes to not come in contact with that shame. So we start to deflect and, all these things on other people and project in other people. So I think that many people have narcissistic traits because of trauma. Because narcissistic are condition where lack of empathy
Correct.
is a main trait. So when you are full of your own traumas, it's not any space for empathy, because you don't have empathy for yourself. You cannot have empathy for others either, right? So I don't know if I answered your question, Steve. I just talked.
I appreciate it, because it's just fascinating, because we think that personalities cannot be cured and we just get stuck. But when I think about narcissism or borderlines or whatever, to me, we're stuck in that frame mind where we were as a child when we got hurt. And narcissism, I think it's just adult bullying, so to speak, because there is that lack of empathy. But when you're dealing with these clients and they're releasing these emotions, it's almost like you say they're cured. And so that's still hard for me to wrap my mind around, because of where I am in the United States, and we're dealing with these different type of personalities because we're compounding our transgenerational trauma.
Yes.
And so dealing with releasing of these feelings, you say that it changes the diagnosis.
Yes.
When they begin healing, is there maintenance afterwards? Is there follow-up type therapy with them to keep them on track? And then do they have to come back at a certain point in time once they do this EQ therapy?
I think that every person comes to a point where the traumas are released, right? But that's a journey. It's not done in 10 hours or whatever. That's a journey. and it all depends on how much work they've done before they come in EQ therapy, right?
Okay.
Some are completely new to therapy, and some have been working with themselves a long, long time in different directions, right? But I think that my clients, many of them want to come back maybe 2 times a year after they have finished their releasing of trauma, right? Just to catch up, just to see maybe something else has happened. Maybe they experience something they also want to have a therapy on to release those, right? But when you really release your trauma, you also get these tools to be able to release them yourself,
Right.
right? So it's kind of a way of living. How you deal with your emotions, how you meet yourself, how you release your daily experiences and traumas or emotions or whatever, right? So it's kind of divided into 2: time before you have released your traumas and time after. Does it
Okay.
make sense? Yeah.
So, is there a specific age that you prefer to work with the trauma? In other words, does this help with, I don't know, maybe an 8-year-old that has had some severe trauma versus an adult, of course, we want to work with and they're able to do that. But is there a target age range that you work with?
I work with everyone. It's like the youngest was 6 and the oldest was 84. That's the range. But the most normal client, it's typically from 30 to 50.
Okay.
That's the main. But I have a lot of youngsters and a few kids. You know, working with kids is a little bit different because they are completely in their emotions when they are. So with them, I talk or they draw drawings, or they express in different ways that I understand, and I pinpoint what they maybe want to say, because young kids, they need an adult to put a name on the emotions in order to be able to express, right? And young people like 15, 16, often they also want to talk, maybe not go into the therapy with closed eyes, because the traumas are fresher, if that makes sense.
Okay.
They are not placed for a long, long time. But the key is to make the person talk about and release and feel. So it depends on the person, where they are. So I see what they need.
So teenagers, that's a melting pot. That's just just a mix of emotions, because they're still learning. They're coming out of concrete thinking more into the abstract thinking. And what do you do when you have this emotional teenager? Do you work with the parents too and try to collaborate some type of healing between the two if that parent is yelling and so forth, causing this trauma? What do you do in that situation there?
Normally it's the parent that contact me and ask if I want to talk with their son or daughter or whatever. And then I always ask, do they want to come to me? The same goes for children, because if they really don't want, it's not right to push them to come to me, right?
Okay.
That's the part. Because kids and youngsters, they might feel that something wrong with them when they go to therapy. Yeah. So it's so important that they go, they want to come. And when they want to come, I am very eager to tell them that, I'm here to listen to you. I'm not telling your parents anything if you don't want to. But if you want to, I can tell. Because many young people, they don't dare to tell their parents.
Right.
So maybe they ask me to, can you tell this to mom? Can you tell this to dad? And whatever. But many times I suggest that the parents come also, because it's a family dynamic.
Yes.
And, the parents are, what do you say? They are responsible. They are the adults. So they might project some of their own traumas onto the kids or the youngsters, right? And that's so important that the parents also come to therapy to work with theirs. And very often, then things start to change because it's, they just pass their own traumas to their kids.
One of the things that I'm finishing my doctorate's degree in research of studying blended families, that the divorce rate is 65% or higher here in blended families that end the divorce prior to the first. And there's a research gap that there's no explanation or understanding in a hermeneutical way of understanding what causes, these divorces. And when I think about the blended family, there are 34 different typologies of blended families. And so now we're compounding not only childhood trauma, relationship trauma, now you're coming into another marriage and compounding trauma. How do you differentiate, or is it all just, do you break down the traumas and segments? Or do you just go straight towards the child trauma that's there first?
It depends on what the person in therapy comes in contact with first.
Okay.
It starts with the adult's experience, right? And then I go further. Can you see a younger version with this emotion? Do you have something else coming up? And then normally we come to the child, because everything starts there. That childhood traumas, they really give us the truths about how we see the world or how we view the people around us.
Right.
So everything after is a result of the childhood traumas.
So It's like peeling an onion. We're going to get to the core eventually as we slowly peel away.
Yes.
And so when we talk about this training, you said it takes 3 years because it's part-time. When you say part-time, like United States, it's about, some master's degrees are like 8 weeks. Some are 16 weeks, depending. Part-time, how long are these classes? Is it like an hour a day session, or is it where? Explain the time frame.
Each month you have 3 days and altogether 18 hours. That's one module, and you have 10 days each year. So it's like 180 hours each year. So times 3. So it's many hours, and it's hard work, and it's amazing, really. And also, even if it's part-time, it's actually full-time, because each time you've been in the class, so much start to happen inside, and you read a lot, and you write a lot, and you cry a lot, and it's an ongoing work, even if it's part-time. So, yeah.
So I believe I gave you a link because there is a group here in the United States called Pathways, where they do that emotional work. Is that the same thing or totally different?
I tried to open that link, Steve, but I couldn't open it. Yeah, so I will read. I think maybe it might be something similar based on what you told me. What do you think?
I just I don't think it's the same because
No.
they do it in groups. And what
Okay.
I'm hearing you say that this is more individualized versus a group
No,
because you,
it's
I'm
group.
sorry,
It's
it's
group.
both. Okay.
Yeah, it's group on 18 students, and but the therapy is like individual by one student and one teacher,
Okay.
but the other students are there. So when they see the therapy, they kind of get the therapy themselves, right?
Okay.
So
So
it's
we
it's
teach in groups, but
yes,
like you, when you become certified, the EQ, the emotional intelligence therapy is
yes,
a one-on-one
yeah, yeah,
because you're holding their back to give them that support to let them know that you're there.
yes.
Okay. And
That's
so it takes 3 years, and you say you were trying to do online courses and things like that. Is there a website that if therapists are interested in learning more about this, what website could they go to?
EQ Institute has their own website, but that's in Norwegian.
Okay.
It's possible to maybe translate or something with the tools online. I'm not sure. But as I told you before, we really work on a course for international therapists to be able to be a certified EQ therapist as well. And that will be online, but it's not ready yet. We just have all these modules and we are figuring it out. But we are working on that.
So, it's so fascinating to be able to learn about new things. And when you think about evidence based, a lot of times when I do my research, I need to go to scholar.google.com in order to find government or just studies. Has there been a study to show the effectiveness of EQ therapy?
Not yet, because it's so young. So it has not been done that yet. But we are certified in the government as a alternative health therapy. So
Okay.
that's quite a big work to be able to be certified there. But have you heard about Gabor Mate, the doctor?
I have not.
No, he's quite famous now, at least in Europe, and I guess he's from Canada, and he is a doctor, and he's talking about traumas and what happens to the body. He really talks about what we are doing in a way.
Okay.
I really recommend you to Google Gabor Mate. And the last book, The Myth of Normal, is fabulous. I recommend that book.
The Myth
Of Normal.
of Normal is a book that he wrote. Okay.
Yes. He has many books, but this is the last one. And I think that he's talking exactly about what we are talking about, but from a doctor's eyes, right?
No, I appreciate, Teresa. This has been some fascinating, just interesting information, a different tool that therapists can use. I will be able to post the website. Yes, you have to translate it to English in order to understand. But Teresa, thank you so much for your time and just some fascinating information that I can't wait to share with my colleagues here in the United States to introduce something different and new. So thank us again for being here. Until next time, take care and God bless. Thank you for tuning in to today's episode on Coach Soul. As we wrap up, we want to remind our listeners of a few key points. This podcast is for informational purposes only and does not substitute professional medical advice, diagnosis, or treatment. The content shared here is based on professional opinion but may not apply to everyone's situation. Always consult with a qualified healthcare provider before making changes to your mental health care. If you're in a crisis, please seek immediate professional help or contact a crisis hotline. Listening to this podcast does not create a therapist-client relationship. For personal advice, please consult with your licensed mental health professional in your area. Remember, your mental health journey is unique. While we hope this information is helpful, it is crucial to work directly with the qualified personnel for your specific needs. Thank you again for tuning in to Coach Soul, and we'll see you next time.